Welcome to the essential section of this website series. So far, we have seen what evidence is and also the general framework how to practice evidence-based mental health. In Lesson 6, we start with a clinical scenario. In the lessons to follow, we will apply evidence-based mental health to solve clinical questions that we may encounter when we care for this patient. The case is a 23-year-old male university student. He experienced his first major depressive episode in his first year in college. He visited a psychiatric clinic nearby, took some SSRIs, and recovered in 3 months. The treatment lasted 4 months. 3 years later, as the patient was working hard into the night every day to finish his dissertation before graduation, he started calling up all his friends to tell them what great inventions he had made. He also invested several $1,000s to apply for its patent. Eventually, several of his friends contacted his parents back home, who took him to the psychiatric hospital. After about a month of hospital admission, he had completely recovered and returned to his normal self. He could not submit his dissertation in time that year and had to repeat his last year in college. He stayed mildly depressed for several months since then, but gradually returned to euthymia with valproate 1,000 milligrams per day. When he came to your clinic, he asked, "I think I am back to my usual self now. I would really like to stay so and graduate this year. Is there any other drug that I had better be on?" You responded by saying, "Well, I think the current one is the best for you because you will return to your normal self on this one. But let me check it up by the time I see you next in 2 weeks."